How to make or break female beauty. Take a look at this picture. Which one do you find yourself drawn towards? Almost everyone will say the image on the right. But why is this? What is the difference that makes us more attracted to the image on the right? There's a lot to unpack here, and this video is going to help you understand how to create beauty if you're an injector or what to ask for if you're a patient. I realized years ago that the face is fundamentally a presentation box for the eyes. What do I mean by that? If you take a look at the planes, the angles, the defining points of the face, including the chin, jawline, cheeks, and the eyes themselves, you will see an interesting pattern. There seems to be a sense of framing that starts in various layers across the face. Take, for example, the jawline. The jawline echoes the cheek line, and the cheek line frames the eyes. Similarly with the eyebrows and the periorbital ridge, there is a framing that occurs. On the upper surface of all of these projecting elements of jawline and cheek is an area where light is caught. And this light reflects up towards the eyes. So what we have is a structure that effectively captures light and reflects it towards the eyes, underneath the eyes, which you can see most starkly in many cartoon characters. Take, for example, the Disney princess in the Frozen series. Just look at the way their cheeks are drawn. They are drawn to frame the eyes and make the contrast between eye and skin as vivid as possible, because this is where our attention is always drawn. Humans are fundamentally a collaborative species, and we collaborate through reading each other's emotions and non-verbal communication. When you look at someone's face, you are reading their face, and the eyes, as they say, are the windows to the soul, which means you can tell the most about someone by looking at their eyes. So we are telling a huge amount about someone by looking at their eyes. We can tell a lot about their age, their mood, their health status, their attitude towards you, and of course their sexual attractiveness. And this is all built into this structure where most of our attention goes. So how can we use this principle to guide good aesthetic treatments? Many of our treatments are designed, if you actually break them down, to make the eyes more vivid. If you remove lines and wrinkles, you are making the eyes more dominant. But you can also downgrade the face, unfortunately, in many ways through overtreatment or incorrect treatment. Take, for example, overtreating the cheek. If you overtreat the cheek, for example, during a smile, you'll see that the eyes become more recessed. They look smaller. They become compressed. I call this effect the hippo in a pond effect, because it looks almost as if their eyes are being flooded by the cheek when they are overtreated. This is one stark example, but also you can do similar things simply by treating a cheek inappropriately, because our brains work in a relative way. That means if a cheek gets relatively bigger, it makes the eyes look relatively smaller. So overtreating cheeks, jawline, lips, nose, temple, forehead actually makes your eyes look relatively smaller. So we need to use the eyes as the anchor point for all of our treatments. So how do we use aesthetic treatments to frame the eyes and not detract from the eyes? The first thing would be to look at existing structures and ask yourself around the area of the eyes, what is distracting from the eyes and what is aiding the eyes? Typically, if there is no catch light underneath the eyes because the cheeks are deflated or flat, then you will see less of the eye. Remember, we're trying to create a sense of contrast between light, reflective skin underneath the eye and the immediate contrast with the lower lashes and the different color of the eye that makes them stand out. So if you have a cheek that is deflated, you can add volume so that you have more of a catch light, because light nearly always comes from above us. But remember, if you overdo this, you may compress the eye during dynamic effects like smiling, or if you create too much cheek volume, you make the eyes look relatively smaller. So we're always trying to make that judgment about what's just the right amount before you cause another aesthetic problem, which I call the Rubik's Cube problem. Solve one thing, but cause another problem somewhere else. Later in the show, I'll show you an injection point, which I think gives you the easiest improvement to eyes of any injection on the face. Having said that, the best approach is actually to consider all of the defining points and planes of the face to create this better presentation box that makes your eyes really zing. And this is really where I like to assess more of a full face approach rather than choosing just injection points around the eyes. Consider first of all the planes that reflect light into the eye. These typically run underneath the eye and are the upper surface of the zygoma and the fat pad above. So as light comes down, typically from above, they will form this catch light, which we want to be reflected also in the shape of the jawline. So a beautiful female face will have a catch light here, then a shadow, and then another catch light, more subtle, just above the jawline that echoes the catch light beneath. So this is why there is this framing effect. So when you're assessing a female face, you can choose injection points that both enhance the point of the cheek, the line of the cheek, and similarly with the jawline. And then you can subtract anything that removes light from those areas. So typically this is a tear trough treatment or a lateral lid cheek junction. Sometimes the temple can also create a shadow around the eye. And if you remove those shadows, you end up with this more ideal presentation box that makes the eyes framed by the rest of the face. So let's look at some real life examples of this in action. These principles are applicable, but they are affected by many other things other than the shape of the face. For example, lighting and the angle of the face when the photograph was taken, as well as makeup. If you look at this example with Taylor Swift, most people would say that the image on the right is more attractive. But what is actually going on? Have a look at the lighting in the image and you'll see there's a much more flat light to the first image, which obliterates some of the shadows which give the sense of framing around her eyes. She also has less eye makeup on, which makes her eyes look relatively smaller. And this is ultimately reducing the impact of her eyes on the image. Even though she is looking directly at you, for some reason, the other image, you want to look more at her eyes than in the previous one. Let's go back to the image that we started with of Bella Hadid. In this image, she looks much more striking and beautiful in the image on the right. How can we apply these principles to understand why, and how can you use this to help you in your practice? The first thing is look at the subtle shades of light in different aspects of her face. Due to a combination of potential surgical treatments, non-surgical treatments, lighting and makeup, you will see a much lighter area underneath her cheeks. This is essential to creating that sense of framing of her eyes and making her eyes more dominant. There's also an interesting difference with her eyebrows, with a catch light that develops above her brow, in the area which we associated with a little fat pad called your retroorbicularis oculi fat pad, and the position of her eyebrow is lifted, which makes it more part of the overall shapes of the cheek and the jawline. Have a look at the parallel lines caused by her jawline and her cheek as well. In the first image, there isn't a lot of definition on her cheek or her jawline, whereas in the second, these lines are vivid. It creates a sense of this structure that is presenting the eyes, rather than simply eyes being inside a structure. The structure clearly has this purpose. That's how I interpret it. So given this information, what's the one point that I would use most often to frame the eyes? Typically, in most people as they age, they tend to lose volume in their cheek, and this catch light that frames the eyes tends to get less. It can sometimes turn into a shadow, which is the most aged form, where the lateral lid cheek junction depletes, and you get a shadow exactly where you'd actually prefer a catch light. So this is the single most important injection I would do, which is if you have a defined cheek, make sure there is no shadow at the lateral lid cheek junction. And this makes the eyes much more vivid and clearer and more beautiful than anything where there's even a small shadow in that area. So why does it seem that some injectors can get these amazing results while others can't? Now, the first thing is there is a lot of this effect that is caused by different angles and position of the head, different lighting, and different makeup. It's a huge component. However, there's another component which we can control, which is looking at the face more holistically and breaking it down into the core principles. Every face is a three-dimensional, not a two-dimensional structure, and is made up of points that define it, lines that connect those points, and planes that connect those lines together. If you assess a face holistically and use the correct ratios and systematically define the right points, while also improving the connecting planes and removing as many distractions as possible, you will get a much more vivid image of a framed face with beautiful eyes at the center. This is a much more holistic approach to what most injectors end up doing. The truth is, in our industry, many injectors are taught techniques, and then many patients will approach injectors for component type treatments. I call this the Mr. Potato Head style of injecting, because you take a component here and you stick it on a face without really thinking about the context in any great detail. This is the missing piece in our industry. We need to learn a system or a formula that allows us to assess every face holistically with principles at every point that we inject that also take into account the context of what we're injecting. If you can do this, you will get outstanding results where other people get mediocre results, because you are thinking about beauty holistically and not simply injecting one area according to your patient's request. If you'd like to get a download of this to help you communicate better with your patients, make better clinical decisions, and assess patients more comprehensively, make sure you click on the link in this video.